Welcome back. My name is Dr. Carl Baird, and today we'll be looking at a few of the key differences between the forward lunge and the reverse lunge for adults with joint pain. So before we get started, I just wanted to reiterate that the lunge movement itself is one of the best exercises to help build single leg functional strength to help limit impact that goes through our joints for less pain and arthritis as we get older and as we move throughout our day. But with that being said, if you are somebody who's dealing with joint pain or arthritis already, particularly in the knee, there are a few differences between the forward lunge and the reverse lunge that make the reverse lunge a slightly better option, and that's what I'm going to show you today. So before we get started, let's just do a quick demonstration of each movement. The first forward lunge is simply taking a step forward, dropping the back leg, pressing up off the front leg to return to the standing position, where the reverse lunge is taking a step backward, bending the back leg, and then pushing up off the front leg to return to the starting position. So the first key difference between the forward and reverse lunge is the amount of strain and impact that you place on your joints. Remember, when we're building strength to solve joint pain, we want to find variations of exercise that build strength while limiting impact on our joints, because the last thing we want to do is re-aggravate anything. And so when we perform the forward lunge, we put a lot more stress, strain, and impact at the knee, because when I take that step forward, my leg is driving forward. I have a big eccentric contraction, meaning my muscle is lengthening while it is contracting, which again puts a lot of strain on our quad and into the patellar tendon before I put that push back. Whereas with the reverse lunge, you avoid that strain and impact at the knee, which is why the reverse lunge is a slightly better option for anybody with knee pain. The second key difference between the two movements is what muscles are engaged while we perform the exercise. So one of the primary imbalances I see in adults with joint pain is weakness in the glute and hamstring when compared to the quad. A lot of times we're more quad dominant with weakness in the glutes and hamstrings, mainly because a lot of us spend a lot of our time sitting, so these glutes and hamstrings don't have to work. So we want to find variations of exercises that target those glutes and hamstrings. And that's where the reverse lunge also is more beneficial, because when we take that step back to press up out of this movement, I engage my glutes and my hamstrings to stand back up, where the forward lunge, again, it's that strong eccentric contraction that's primarily going through the quads when I stand up. So that's the key difference, and why I like the reverse lunge, because it targets those glutes and hamstrings just a little bit more than the forward lunge. And the third reason I prefer the reverse lunge to the forward lunge simply has to do with the amount of stability and control with the movement. So again, when we're picking exercises to build strength to solve joint pain, we need to make sure that the exercises are safe and we're able to control them. And with the forward lunge, there's just a little bit less control, because the leg that's doing the work, this front leg, is in an open chain position, which if you're somebody, maybe you don't have the single leg strength yet, maybe you struggle with balance, can lead to a little wobbly side to side, which might do something to re-aggravate any sort of knee pain or joint pain that you might have. Where the reverse lunge, the leg that's doing the work, never leaves the ground. So you have a lot more control, you have a lot more stability. So as I take a step back, I can really control this movement all the way down. And when I press up, again, it's strong and stable, because all of the work is happening through that front leg that never left the ground. So there you have it, just a few of the reasons why I prefer the reverse lunge to the forward lunge for adults with joint pain. Remember, when we're building strength to solve joint pain, the exercises not only need to be effective, meaning they target the right muscle group, which the reverse lunge targets those glutes and hamstrings, which we prefer, but they also need to be safe, meaning they limit the impact that goes through the joint itself and provide a little bit more control, both of which the reverse lunge is better at doing, and why you should pick that exercise to add into your routine. That's all I got for you today. If you have any comments or questions, leave them down below. I do read them, and I'm happy to answer.